I'm here to add my voice on behalf of government about the situation of this Ebola in my country, and indeed in the Manu River Union Basin, Liberia, Sierra Leone, and Guinea. Well, I want to refer to something first. This is a global disease. It's not only for Liberia, Sierra Leone, and Guinea. It is a continental disease. It needs continental approach or global approach in order to eradicate this disease as soon as possible. We in Liberia cannot at this moment arrest the spread of this strange disease in our country. But our government, or my government, has put in place or developed what we call operational plan for accelerated response to the Ebola epidemic. Though limited, but government is doing everything possible to arrest the disease. In collaboration with the Ministry of Health in my country, a concerted effort to interrupt the current wave of the epidemic has been put in place. From the onset of this epidemic, a multidisciplinary task force chaired by the Minister of Health was activated to ensure effective coordination of the response to our efforts. The current response we have and challenges we are facing now with our international partner to respond to this current wave of this epidemic disease that is ravaging the lives of our people. Response activities are being implemented in all the affected counties. That is, we set up a team, we call it isolation and treatment team, in all the counties, in the 15 counties in Liberia, to educate the people about this disease. Now, let me just digress a bit. One of the problems we are facing in arresting the disease is that people, that is the population, majority of the population, do not want to accept that this disease is existing. Now, this is a problem. I mentioned it before in The Hague. We need to educate the people. If we don't educate the people, believe me, my population is about, we say 4 million. Now, according to the statistics I just heard, 4,000 gone, and 2/3 of this 4,000 took place in Liberia. So, it's the question of education and health. To clean their environment, we have asked our health workers to teach the people to live in a hygienic environment. So this is some of the effort the government of Liberia is putting in place, and the National Task Force is also working very closely with our international partners to consolidate this effort. However, we have again had some goodwill from a lot of international partners who are coming in to help because our resources are limited and our health workers are insufficient. So, with the support of our partner, the following actions were also undertaken. National technical staff deployed to support county efforts in the affected and risk counties. Now, we divided our country into risk counties and affected counties. Those that are already quarantined, to stop them from moving from that county to the other county. And this is very difficult. The proximity of the counties will not permit sufficient control by the health worker or the government. Again, we have a problem of movement of people from one county to another county. It is impossible to control them. For example, Guinea and Liberia and Sierra Leone, the border between, or it's just like how we're sitting across one another. You're in Liberia, you can see the people in Sierra Leone. You're in Sierra Leone, you can see the people in Guinea. So to tell the people who are actually, well, not educated, not to be free movement, to restrict their movement, it's actually almost impossible. So this is one of the problems we are facing, and we are working very hard on it to educate our health workers to try to contain the people in the places where they are. Despite our effort, people are still moving about. We have an emergency medical supply, including the PPE kits, mobilized and sent to responsive counties. Now, the government has, with it, international aid, we have I heard the Americans that they're building treatment unit, hospitals and things like that, but the people have not yet started coming to be treated. They are only constructing. Now, construction and treatment period, people are dying. People are dying, and then the people in the population, most of them skeptical. They're very skeptical to visit the treatment center because, again, education. They say instead of treating them, they will give them something to kill them. I'm just putting it roughly like this. This is what's happening. Scare factor. Because when it started, a lot of people actually they were oversick and they were not treated properly, they say, and they died. So the second wave now, we say, look, we have had an isolation unit and treatment unit, please come. They said, no, we were there the other day, we died, so I will not send our people again. So this is the problem we have in trying to consolidate the effort we are making to have these people, to treat them in a way that they can be able to get rid of their disease. Now, treatment centers scale up to accommodate increasing number of suspected, probable, and confirmed cases. That's another issue again. We ask the fellow, you are sick. He said, I'm not sick. Now, how do we convince this person? As soon as you isolate them, they move from where they are and go into another community. Or they say, some of them say, look, we've never been fed. As a result, we are leaving. So again, food crisis. Food crisis. People are saying they are hungry. They cannot remain in a quarantine area because they are not being fed. So we are asking our international partner to help us again to try to ease this food problem. We appreciate the medicine, but people are, before you take a medication, you have to eat. So people are talking about food. They don't have food, and we don't have sufficient food bank. This is why I was, in fact, trying to say the ACP or the African Union should consider creating an African food bank. So after post-Ebola, what will happen? The economy all being devastated. People start getting hungry. So this is about time for the African Union to think about African food bank so we can be able to feed our people. So with this again, the daily situation update produced and disseminated email to partners among our other countries. Despite this progress, there are operational gaps, challenges that affect scopes and quality of the response in the urban area. Now, one of the problems I felt that the government is doing now is to educate the poor. I want back to education in the vernaculars of the country, because people are speaking English in Monrovia. That's the official language. And in a village, most people don't even understand what you're talking about. So we try to tell the people, teach the people, or disseminate this information in their own languages or in their own vernacular to be able to understand what is going on. That's the problem we're facing again, to teach the people to understand that this is a serious problem. Now, coming to disposal of the body, disposal of the body from the Ebola epidemic. You know, in our traditional way of burial, we are not, which have been introduced in Liberia recently, to cremate the body. To us, this is very, very strange. The African, if I could speak, if not, use this kind of way of burial. Very sentimental, and most of the family members of the dead try to touch the body. And I understand once you touch this body, the disease is transmitted to you, and then you touch another person, and then it's spread. Now, so in a burial situation, we have to educate the people to tell them, look, we have to cremate the body. If we don't, you will spread the disease. But yet and still, the government is unable, I repeat, unable to supervise all the burials that are taking place in the different places. So this is some of the problem we are facing, this traditional mentality of treating the dead body. Now, the other problem we have in our country, and we are doing our best to overcome it, is the health workers. The health workers are at risk. Now, I don't know where this one coming from. They are complaining, saying we are here to brainstorm to tell what is happening, that they are not getting sufficient salary. They are not being paid properly. As a result, dead bodies sometimes remain on the street or wherever they are for more than 2 to 3 days without people touching the body to dispose of it. So we have to, the three governments have to also look into that possibility to please try to increase the salary of the health workers so that they can be able to work. Then we have a limited time. I won't go into all these things, so I thank you very much. The attendance here today is very impressive. And before I close, I want us to please look at this disease as a global disease. It's not only just Africa. It's not just only Africa. It's all over the world. It's a question of time. And all African countries, not only West Africa, it's all over Africa. So let's all try to take our measure. Thank you very much.